The results have been good, but I won't say that it has been extremely good. We have done much better in earlier quarters. But this was expected because this is a lean quarter when you look at the GCC. As you know, people travel, summer vacation, Ramzan. So, a lot of things which has led to not so very excellent performance in GCC, especially when you look at the EBITDA level. You will have to take out the COVID revenue, which was one time or an abnormal revenue which came in and provided significant profits. There has been an impact of the COVID last year with significant increase in the revenue, which is not sustainable. So, whatever we are doing now, we think it is sustainable and compared to the year earlier to that. So, for the coming quarters, it should be doing much better than the first two quarters are usually the weak quarters in GCC. So, 80% of our business being from GCC, the next quarters must be definitely better. That has been traditionally like that for over many years. India has been doing extremely well because we have 25 to 30% of our business coming from India, and that business is growing. India is a growth market. Unlike GCC, the number of people, the opportunities for growth is huge. The expansion plans for India in the places where we are active, that's in the South India, is quite robust. We have lot of hospitals which are coming up, new beds being added to existing hospitals, and that is something which we are driving very aggressively because of the growth that is happening in India. So, for example, we are starting a new hospital in the state capital of Kerala, where we have large business, bringing in a 500-bed hospital, of which 350 is the one which we are starting first. Now, we are starting another one in Kerala in Kasaragod, and we are also starting our hospital in Bangalore. So, multiple hospitals, and apart from that, we are also looking at this brownfield opportunities, which is through the operations management. In the near future, we are not looking at an expansion into North India. That will be something which we will look at once we are stabilized. We do not want to spread too thin, so we will be mostly in South. This is because of the financial reasons and the ability to roll it out quite quickly. If you plan a hospital, acquiring the land and building, as well as overall, it takes at least 3 to 4 years for something to come on stream. Whereas if there is a hospital which is struggling, or if there is something which has been built and the promoters or the people who have built it, they are not capable of running it, you are talking about immediately starting it, and your investment also is very low. Of course, you have to give a rent, but when you look at the overall benefits, we have found that that's much better. And our capital which is utilized is also very minimal. In that way, starting brownfield or starting something like operations management is the best way in which we can increase our presence quickly and with low capex. The expansion can be mostly funded by the internal accruals. We have significant amounts of profit coming in. If you look at our last year's profit, the EBITDA was in the tune of $135 million US. And we also have the ability to take more of loan from the banks. So, there is a possibility, and the loan, the percentage of interest also is very attractive. So, what we are looking at presently is to, one, use our own funding which is available, as well as to look at the bank facilities. We are in the process of a restructuring of the company. The board has approved a restructuring, and there are investment bankers looking at various ways in which we should be doing this. So that process is on, and depending on the outcome of that, there could be a relisting or a listing that can happen in Dubai, Abu Dhabi, or even other stock exchanges. Saudi has been a market where we are there for last 7 years, but we have not done very well. To be frank, this is one area where we didn't do very well. But now we have realized what is required in Saudi, and that is something which has made us realize the importance of having a local partner who is actively involved in the business instead of we ourselves doing that. We will definitely be looking at the opportunity to invest into all the sectors, starting from primary care, which can be clinics, pharmacies, on to secondary care hospitals, to tertiary and quaternary. There is a requirement for tertiary quaternary care, and government also is looking at ways to support players who are coming with such expertise. Opportunities in Africa as a growth market is tremendous when you look into the future, and Aster has not been so far directly involved in Africa. But now we are looking at opportunities for establishing some physical presence there. But it's just in the initial stage of discussion with some of the people there, surveys and all, but we have not done anything serious so far. But that is one market which we should be present as we go forward. Dubai, as you know, is the place where there are a lot of plus points for bringing medical value travel or health tourism, because it's the place with the best infrastructure anywhere in the world and also very well connected. Earlier the issue was the availability of expertise. There weren't all the specialities that were required to provide health tourism in Dubai or in UAE. That's completely getting transformed. You have excellent hospitals where everything can be done, including our hospitals in UAE now. So people want to come to UAE, and they also are happy to come here, especially from the Middle East, where there is 1 billion population, the MENA region, because the language and cultural preference, apart from the benefits of having good infrastructure for accommodation as well as travel. This is also very important. People feel very comfortable. And another important thing which I should tell you is that when somebody goes for medical value travel, the patient of course is going for the best treatment, but the relative wants to be in a place where he can also go around and see and he can enjoy. So Dubai has got all that with all the wonders of the world around. So people want to come to Dubai. So we are promoting it very heavily along with the government, and we are trying to get patients from different parts of the world, including CIS countries, the Middle Eastern countries, Africa and all, to Dubai.